what's happening is your body's producing way too much insulin, right? And then you're given metformin for it for your blood sugars, right? So that's another really common medication for PCOS is like, here you go, take metformin. Great. So metformin is really good at like improving the cell sensitivity to that insulin being produced. But what about the production? Like, where is that coming from? What is going on? Why is there so much being produced in the first place? So that's typically the starting point is what I feel when we talk about the metabolic nature of PCOS. I feel like that plays one of the biggest roles.
Today, we're diving into a topic that bridges two important areas of health that are often treated separately: your gut and your hormones. In today's episode, we're exploring PCOS and dysbiosis, specifically how your gut microbiome can influence the development and management of polycystic ovarian syndrome. Joining us today is the incredible Sana Motlekar, a registered dietitian with a Master of Public Health, specializing in PCOS, weight loss, fatty liver, and diabetes. Let's get into today's discussion. Hi, Sana. Welcome to the show. So happy to have you on today.
Thanks for having me. Really excited to chat.
Yeah, I've actually gotten quite a few requests to do either like an article or a podcast episode about PCOS and gut, potentially IBS connection. So I'm really happy to have you on because I know you specialize in this specifically. So it'll be really good to have a chat. And PCOS is obviously like very common. I think last I checked, the stat is like 6 to maybe 12% of the population, but it also
for sure. Totally. Because usually the standard is like 1 in 10 women has PCOS, right? But that's based on the information we have and the statistics they've collected. But I'm sure there's more because a lot of people get diagnosed way down the line, or they get sort of, just dismissed by their doctors and nothing's done about it. And then much later, they'll get to realize that, okay, that was PCOS all along. So yeah, it's very underdiagnosed.
Yeah, I think I saw the stat was like 70% people go undiagnosed. So even though 1 in 10 is probably, a real underestimate in terms of
totally. For sure.
That's our. So yeah. And I think the thing is too, it also like, obviously there's like the symptoms that you deal with directly, like the irregular periods, but I know that it can contribute to, I think, other sort of whole body issues, specifically like metabolic issues, blood sugar dysregulation, weight gain. So yeah, considering it's so common and important, I'm happy to chat about it today.
Yeah. Awesome.
Just to start off, why don't you maybe give us some background about yourself? Probably some people listening are familiar with you, maybe came from your audience, but for those that aren't, you can tell us like who you are, what you do, who you help, and
Yeah, for sure. So my name is Sana and I am a PCOS and weight loss dietitian. Obviously I didn't sort of like fall into this right off the bat. Like, when we go through university, it's not like we get specialized in anything specific. So we get to explore all different areas. So I've done like a little bit of renal, I did a little bit of bariatric, a little bit of cancer and whatnot, right? And I think it was second year of university and I was on holiday. So I was visiting my family back home and I noticed my sister had like metformin. I'm like, oh, this is a blood sugar medication. Why do you have it? And then she said like, oh, I went to the doctor and she said I had PCOS. I'm like, what is PCOS? And I had no idea what the hell it was. And so honestly, that is the light bulb moment for me because I was like, what is going on? Why are they using blood sugar medications for this? And I started sort of like going through my own sort of like research. And again, even at university level, everything is very generalized. So they'll just tell you, make sure you're eating more complex carbs and increase your protein. It's very generalized guidelines. So you can't really make much of a difference with just that, right? Because again, when I went through the whole like research phase, I'm like, okay, PCOS shows up very differently for every individual. So not like two women can't have the exact same symptoms. They can have very different, it shows up very differently. We have lean PCOS, we have clients who are also trying to manage their weight. So yeah, it took a while just sort of like going down that rabbit hole of sort of understanding what it is, what the connections are. So, even though it's like a period issue, but if you told me to round up what PCOS is, I would say it's a hormonal and metabolic condition. So yeah, so that's kind of where I started, and then obviously started my practice, and I work only with women, and also women who come from different cultural backgrounds, because that's really important to me, because that was also a huge gap in terms of finding resources that can be sort of adapted to people who came from different cultural backgrounds, right? Again, when I was doing my internship, every document, every resources we had that we could sort of share with people, it's very, very generic, right? So yeah, that was my interest in just sort of learning different culture diets. A lot of my friends come from different cultural backgrounds, so that's super, super helpful. I learned so much from just sort of, interacting with different people. And yeah, that's where my sort of practice started from.
Yeah. I guess
Yeah.
going back to that, have you like helped your sister at all, or?
Yes,
I know
actually
we
my
technically can't like
yeah,
counsel.
I know. Yeah, totally. Yeah, huge difference. And the other thing is like every woman in my family, so genetically there's a huge sort of genetic component that runs in my family. So every woman, every cousin of mine, we all have some form of PCOS. Some are able to get diagnosed and some can get diagnosed for it just because they don't meet that criteria, right? Being that, you need to meet two out of the three criteria to get diagnosed for PCOS.
Right, right. Yeah, I guess it's described as like a hormone imbalance that
Hmm.
impacts like the ovaries, play a role in the reproductive system. Can you sort of break down like, yeah, just what the diagnosis of PCOS is?
Yeah, for sure. So typically the way it shows up, a lot of times when people are like, "Oh, something is off with me," it's usually the period, because that's something that comes every month for women. And when that starts to sort of like go missing, they're like, "Okay, what's going on?" So missing periods is one of the criteria, or irregular period is one of the criteria. Second being sort of having more facial hair growths or hirsutism or hair loss. So just kind of signs of elevated androgens. Now, something important to see that I have clients who tell me that they've done labs and everything looks normal. So the doctor's like, no, you're fine. Your androgens are okay. But I always tell them that you want to go by the symptom your body is showing up, right? So if you're still having excessive hair growth, hair loss, it's telling me that your body's not loving even maybe that one uptick point in your androgen levels, even though if it's in that normal range.
Right.
So we can't look at it as like, okay, black and white situation, right? So the androgens, and then of course, third, if you end up getting an ultrasound and there's cysts on the ovaries, then that's the third. So you just need two out of the three to meet that. And even with like the uh the scan of like the ovaries, I always tell my clients that it's not permanent. Like those cysts are not permanent. They change every 3 months. The picture of your ovaries start to change depending on obviously the input you're giving them in terms of like, your diet, lifestyle, environment changes and all that stuff.
Mm-hmm. I think it's breaking down the irregular periods a bit more. Is that either like a skipped period or long
Hmm.
cycles, which I think is defined as like
It
longer
could,
than 35 days?
yeah, exactly. So it could be like people don't get it for like 3 months, could be anywhere like 35 to 45 days,
Mm-hmm.
and longer sometimes. So
Mm-hmm.
I have clients who start off with me and they haven't gotten one in 6 months. So it could also show up as that. And in terms of like the science behind, or like what's manifested in the body that causes your periods to go missing. Again, it's so like PCOS is so complex. You can't
Yeah.
just like pinpoint that one thing, but like, yep, that's it. And so when there was all these things on social media, like, what's your type of PCOS? Let's do a quiz and tell me what, I'm like, no, there is no type. It's usually a manifestation of these different things, right? So I usually describe PCOS as like a spider web. And in order to kind of clean that web down or bring it all down, you can't just like pull on that one string. You kind of need to like work simultaneously on all these different areas in order to kind of sort of put your symptoms into remission.
Yeah, that makes sense. I guess
Yeah.
going back to it being like undiagnosed for a long period of time? Do you find it's also like misdiagnosed first? Like people are sort of told that there's another condition, or do you think it's just more commonly they're told that nothing is wrong?
You know what? The most common thing, not like I know endometriosis is often misdiagnosed. I've heard that a
Yeah.
lot. But with PCOS, I often just find that they're just dismissed in the sense that they're typically showing up at their doctor's office, potentially a little overweight or whatnot. And your doctor's like, oh, it's because you're not active or it's because of your weight, right? So that's why your periods, you don't get a diagnosis or they're not taken seriously because that's what's typically happening. Have you sort of like come across something else in terms of like misdiagnosis?
No, not specifically with PCOS. Yeah, I would say rather just being like undiagnosed, or it just takes a
Undiagnosed, yeah,
while
for
for them
sure.
to get like do the
Yeah.
investigations, especially here in Ontario. It's like delay to do the pelvic ultrasound and then
Oh my God,
blood
yes.
work and then referral to an endocrinologist. And like it can take
Correct.
a year
Yeah.
just to go through like the testing.
Yeah,
Um,
actually,
yeah.
having said that, it's usually also when you show up to your doctors and asking that, hey, I feel something is off and I need to run these labs.
Yeah.
They all often say no. And then sometimes clients are like, yeah, my doctor's ran labs for me. And I take a look at it and it's the very generic, very basic things. That's not going to tell them anything, right? So that's happening. And then again, depending on your cultural background, if you're South Asian or Hispanic and you generally have a little bit more facial hair or just like more body hair, then you're just like dismissed. You're like, no, it's normal. It's just genetics. It's just, how things are with your cultural, women. So that could sometimes also be an issue. Same thing with women with hair loss. They're complaining, hey, I've got a lot of hair loss. Now, if you are South Asian, you have like good, like thick hair,
Mhm.
the doctors are not going to take you seriously. They're like, you look fine. Like, there's nothing
Mhm.
wrong. You're fine. Just wait for a couple months and then come back. But that's why, like, they just don't take the patient seriously.
Yeah, yeah, it can be tough. I know. Yeah, just with our medical care
Medical system.
system, there's only
Yeah.
limited time. I think doctors
I
only
feel
see
for
for like
doctors
7 minutes.
too.
Does it?
Absolutely.
Yeah.
Absolutely. There's just not much time. They work till, death themselves. So I get it. It's the system that's the problem, right? And the doctors are just doing what they're expected in that certain time frame. Yeah.
I know for me personally, I think I was misdiagnosed, but maybe the way that you described like the cysts, how they can change, maybe it wasn't. But when I was in my late teens, maybe it was early 20s, because I had, like, I'm open about this, but since I had
Yeah.
first gotten my cycle, like it had always been irregular. Like I would skip
Hmm.
months at a time, and then it would be normal for a little while, and then go away. I did like the lab work. We also did a pelvic ultrasound. Doctor said that there were some small cysts, but I didn't have
Hmm.
high androgen levels. I didn't really
And
have symptoms of that, but
hmm.
I was told by like my family doctor at the time that I had PCOS, and then told to
Interesting.
go on birth control as the way to
Right.
fix it, which we'll get more into. But
Yeah.
since then, I actually ended up seeing like another doctor, and we did more testing, and I actually was referred to like an endocrinologist who was really great. And for me, it wasn't.
Amazing.
I think we detected it wasn't PCOS. For me, it was actually just hypothalamic amenorrhea. Like I was just
And it sounded like that.
high
Yes.
activity, not eating enough, high
Yes.
stress, and based on that, I actually had low estrogen and wasn't able to have like a normal cycle. So all
Hmm.
that to say, I became a little bit of an expert in PCOS because I thought that I
Yeah.
had it, but I think it
Yeah. Yeah. Yeah.
was not quite the full picture. But like you said, it can be complex, and like it's
Definitely.
like polycystic ovarian syndrome, right? With a syndrome, it's like a
Hmm.
collection of
Correct.
symptoms which can exist in other conditions too. So it can be quite complex, and I think even just to like nail down the diagnosis can be,
Totally.
yeah.
Yeah.
I guess, yeah, with all that said, like I know it's one of those conditions too where we're like, oh, we don't really know what causes it. It's unknown, but I'm assuming there's some pretty strong theories. I guess, do you want to maybe walk through what what's
Yeah.
yeah.
Yeah, for sure. As I said, like it's a web, right? So it's often like a combination of things that I see in my practice with women.
Mm,
One of the starting point is often the insulin resistance
mm,
aspect, which is also something that honestly gets missed so often in the labs. because what's usually done is you check your HbA1c, right? And that's often in the normal range. And you're done your fasting blood glucose, that's in the normal range. Your doctor's like, yep, everything's looking good. However, when you're looking at those numbers together and you're looking at your HOMA IR, you will always get an indication of that, oh, this person is actually insulin resistant, right? So it takes a while for the stuff to sort of like unravel. So there's so much we can do if we're just told properly that, hey, I've checked these numbers, I've done your ratio, and this is what's at. So just be mindful and try to work on improving your cell sensitivity to insulin. Now, that is typically the biggest piece. So I often would start my clients off there. That's like my first phase, is helping them just regulate their blood sugars better, improve your cell sensitivity to the insulin, because what's happening is your body's producing way too much insulin, right? And then you're given metformin for it, for your blood sugars, right? So that's another really common medication for PCOS, is like, here you go, take metformin. Great. So metformin is really good at like improving the cell sensitivity to that insulin being produced. But what about the production? Like, where is that coming from? What is going on? Why is there so much being produced in the first place? So that's typically the starting point, is what I feel when we talk about the metabolic nature of PCOS. I feel like that plays one of the biggest roles. Right. And then, of course, we do know that more insulin means the communication with your ovaries is telling it to produce more testosterone. More testosterone means like, okay, your periods are going to get irregular. And then all the other symptoms start off with that. Right. So we want to take care of that piece. Genetic, I mentioned, as I said, that it's a very common thing. Like if your sister has it, or your cousins or your aunt, someone in the family has it, there's a higher likelihood of you having PCOS as well. So that's important to look at. And then it's like did the chicken or is it the egg that came first situation? Because there's always inflammation. So we don't know that, oh, is it inflammation that makes you insulin resistant? And then the insulin, or is it that, oh no, the insulin resistant then makes you more inflamed? Because that's also a pathway, right? Where you start to develop more inflammation in the body. And then the one that I focus on a lot is the stress and your nervous system. And of course, with you also doing you coach for IBS, and the nervous system plays a huge role in your gut too, right? So that's another pathway where I find that clients who've often gone through really major episodes of either trauma, whether it's in childhood or adulthood, that typically puts your body into fight and flight. So even when the stress is sort of like taken away, your body is still reacting the same way. It's not able to sort of downregulate and move into their safe space. So then again, your body's making all that like cortisol from your adrenals. So that has a lot to do with your adrenals working really hard. So that's where I find a lot adrenal issues are common with lean PCOS women as well. I find that in terms of the trend that I've noticed with my clients and the pattern I've picked up on, that's very common. So often their DHEAS is elevated, which is like the other androgen, not the testosterone. And that will only come from your adrenals. So that's very responsive to cortisol. So these are like the typical things that I find is like basically root drivers of PCOS. Yeah.
Yeah, that makes sense. I guess, yeah, going back to the insulin and just to define it. So insulin is a hormone produced by the pancreas that essentially acts as like the gatekeeper, I guess, to tell
like a lock and key
sugar into the cell. Yeah. So if our cells are not as like sensitive to insulin, then our sugars are going to build up in our blood because they're not making their way into the cell.
Correct.
We're in sort of like a place of like wellness information is so accessible and everyone's into their health. But I think we're also seeing like globally an increase in sort of like insulin and maybe metabolic driven conditions. So I think not even just with PCOS, but also fatty liver is on the rise.
Exactly.
Like obesity, other things too. So I think even going back to not knowing what causes PCOS, the way that you break it down, I think that we can kind of see how maybe it's, part of the greater picture of health, society health that maybe, we're kind of
honestly
understanding now.
Totally. There's so much more research left to do, right? We don't even have all the information, but just from like what we're seeing, the patterns, we can make sense. And we're like, okay, where should we focus our energy on? And what can I do? What changes can I make to sort of like improve the symptoms? At least we have like a starting point.
Yeah.
But yeah.
Yeah, it's interesting. I guess with the chicken or the egg idea, like I was going to ask, do you think that insulin resistance is often the cause of PCOS? I guess I had always thought of it as like PCOS leads to insulin resistance, but now that you explain it that way, actually,
Yeah,
that maybe it's the first to happen and then it contributes.
I think so. Like I would think that something is happening, right? Whether it's like lifestyle changes have happened or common thing. Like I have clients who've gone to university and now your environment has completely shifted. Your stress hormones have gone up and then they start to notice all these symptoms. So it's again like a combination of like the stressors, your blood sugars going out of whack, or your insulin is being produced potentially from stress. Even if you're eating really well, your body can still be producing all that excessive insulin just from responding to that excessive cortisol production, right? So again, it's like I feel like there's always something happening in the background apart from like, okay, there's insulin production, but I feel like there's always something else. So it could be the stressor or it could be, the environmental aspect.
Yeah, for sure. Even diet components, which we can get more into.
Yeah.
I think like just a common lack of fiber in the diet.
Oh my God, yes.
Regular eating patterns, like all that stuff definitely contributes, and we see it amongst like other conditions too. Yeah, from your perspective, I know I mentioned like personally, I was told to take birth control pill to help with PCOS. What do you see as like someone goes to their doctor, like they find out they have PCOS, they're given information to manage it from like a medical perspective, and then second layer to that question is like maybe to dive into a little bit more around what you feel is like sort of primary management PCOS.
Yeah, for sure. I feel like the most common ones that are prescribed is definitely birth control and then metformin. So those are the two common options provided. But when you look at the first line of treatment, it's actually nutrition and lifestyle. That is the first line of treatment for PCOS management. But anyways, then you're provided like birth control and metformin. And yeah, in terms of like, did you say like what to sort of like how to address it? What was your other question?
Going back to that, do you feel like either metformin or birth control really help with the PCOS, or what is your
good question? I like to keep an open mind, right? But I would say when like with the women I've worked with, I would say only 2 clients I found were good candidates to go on birth control because they saw no changes, and that's a very small percentage of my clients, like extremely, extremely small. Because majority of them, when they sort of like work on their blood sugars, they worked on their nervous system, they're working on their gut health, their symptoms sort of like just fall into place. So they kind of experience the remission of all the symptoms, right? Metformin, again, when I explain what like metformin is doing, yes, it can get you to a certain point in the sense your cells can just be more sensitive to that insulin, but it's not going to stop your body from producing all that insulin. So you need to still look at what's driving the issue rather than putting like, okay, just sort the cells out. Like just, it's a Band-Aid solution, right? In my opinion. So that's kind of how I feel about it. It's like, fine, go for it, but you can't just not look into the deeper drivers of your symptoms.
Yeah, definitely. I think the argument too with the birth control is that if someone is like missing periods, I think it's a risk to go more than 3 months without having a period. Like, I think it increases your risk for endometrial
cancer and endometrial cancer. Yeah,
so
you're right.
I guess that's the concept, or what the doctor's thinking is maybe just the fastest way to minimize that risk. In a sense, it's like, take this pill, then you bleed, then we're reducing this, like the risk of cancer. But to your point, it's like, if we really want to get to the deeper root of the issue and, maybe prevent like other conditions that are related to insulin resistance, then
absolutely.
Absolutely. Dietitians, but I always think dietary lifestyle component.
I mean, I do tell my clients that when they come to me and if they haven't had a period for a really long time and they're rocking up at like 6 months, no period, I'll tell them that, okay, let's get started. However, you may want to talk to your doctor and get like a period induced, right? So you can be on that 7-day pill and just sort of like shed the lining And then while we work, we can sort of like work on regulating your cycle. But I've also had clients who decided not to go that route. And then 2 month in, 3 month in, they ended up getting a period anyway. But it was a really long period, right? Because there's all that lining that needs to be shed too. And then it just sort of like improves from that point on. But yeah, there's a place for everything. It just depends what you're comfortable with, and having all the information. That's like the really important thing, is not everyone is been told that, okay, this is what the birth control is doing. When you come off it, your symptoms can go worse, right? Same thing with metformin. You need to be on it, but it doesn't reduce all that insulin production. So as long as you have all the information and make a sort of informed sort of decision, that I'm okay with, and I'll support you with the nutrition side of things. It doesn't matter.
Yeah, yeah. And yeah, I think we're sort of in a situation now where there's like information overload, like
Oh my God,
on social media about
yes.
PCOS. So maybe in some sense, like we have access to a lot of information about this, but I think for people who are maybe not as like health literate, it can be hard to make sense of all the information. So I think to that point, like ask your doctor like lots of questions, like yourself, make sure that they inform you of all the risks. But I think connecting with someone who does have a strong science background, a regulated health professional, someone who specifically specializes in PCOS in this condition, like that's where you get your information from, and maybe be a little bit critical of everything online, because I'm sure you could find things on TikTok about what to do for your...
I don't even know what to say to you. I have clients who have come to me after working with so-called PCOS coaches, who are people who've had PCOS and now they're going ahead and coaching people, right? Very unregulated stuff. And that really scares me in terms of like putting your health in someone's hands that haven't had the educational background. So yeah, you are right.
Yeah. And it can be stressful too. Like I have someone who posts my videos on TikTok, but I've never spent more than like 5 minutes on there, because I find it like, for me, it's stressful because I see all this like weird stuff. But I can imagine for people who maybe don't have a health background, it can be like overwhelming. And then you get more anxious about how to manage your condition. And then to the point about the nervous system regulation, then you're anxious about how you're feeling, and what you're doing for it, and you're maybe develop disordered eating, and it can kind of spiral into, not the best coping mechanisms for the condition.
Totally. Yeah. It feels like this person's telling me don't eat gluten. This person's telling me don't eat dairy. This person's eating, don't eat this, don't eat that. And then it's like, okay, what do I eat? And you get like paralyzed, right? Like a decision paralysis. So you're like, okay, I don't know what to do.
Yeah.
So yeah, it's very overwhelming to be on social media and seeing all that, for sure.
Yeah. So yeah, maybe say to whoever's listening, take breaks. Don't have the app on your phone, and be very careful about who you...
Yes. I often even tell my clients, unfollow as many as possible and just limit it to a few people whose messaging and content you like. It's professional and it's positive and it's not making you feel like shit. So then just limit and then block the rest, so that you can focus and just like work on you and not look at what everyone else is doing, or what your colleague is trying today and what your neighbor said would help and things like that, right? So you can just shut that noise off a little bit.
Yeah, exactly. Definitely. Going back to the period piece too, I think yeah, like to your point about weighing the pros and cons of the birth control, because I do want to say, like, it is important to be having like a regular cycle, and that is something that we want to fix. But maybe, birth control maybe is like later down the track if you've tried sort of the primary.
Exactly. Yeah, as I said, like I've come across like 2 clients. I'm like, yep, I think you are a good candidate. Let's talk to your doctor and do that, right? As I said, there's room for it. There's a place for it. Once you've sort of like done all your basics, right? You've worked on your nutrition, you've done done everything else. And if still your body's not responding, then there's place for it, for sure.
And I do want to go back to, I guess, for whoever's listening, my periods are now regular, if anyone was
good to know.
Anymore, but
good to know.
Yeah, I think I saw the endo, maybe we worked together like 5-6 years ago. And once I had an understanding of that's what it was, then it just for myself, because obviously like I'm,
you exercise a lot as well, right? Yeah. and you
Yeah.
exercise a lot, and then you just had to kind of like fine tune your food and make sure you're getting enough like nutrients and stuff like that.
Yeah, for
Was
me, it
that
was
the
just
main
the
thing?
balance of the stress. Like, I think, like, I was trying to
Mm,
work out a lot, not having enough carbs, and then layer on that maybe
correct.
not the best sleep hygiene. And once I sort of
There you
realized
go.
that and figured
Nice.
it out, actually for the last like 4 years, cycle has been like
Beautiful.
spot on. And
Yeah.
my endo said like she's very rarely ever seen someone cure their HA. So I was like, yes, for
Yes, of
science, it
course. You're
works.
like, yeah.
Nutrition. Yeah.
You're like, I'm the research here. I'm the project. So I'm going to work on myself and
Yeah.
see trial and yeah, that's amazing. That's
Yeah.
amazing.
It's interesting. And yeah. Once like just being consistent with it. But yeah. To the
Yeah.
point though.
I,
Periods
I
are
do think, yeah, I do think a body is a very intelligent system.
yeah.
I truly, truly believe that your body is extremely smart. The feedback you give it or whatever, like the inputs you're giving it, it's
Mhm.
going to then tell you how things are going, right? So your symptoms are often just like cry for help that, hey, something is not right or something is off. Let's dive in and figure this out.
Exactly. Yeah. We need to, I think to that sense, pay attention to like what it's telling us for sure. So let's dive into a little more around like the gut hormone connection. So I guess to start, I'll ask you, do you see like an overlap of people with PCOS and then digestive conditions like IBS or GERD or IBD?
Yeah, so I will often see common symptoms such as bloating. That's a big one. Bloating, constipation is a big one too. I see some IBS, so they're actually diagnosed with IBS as well.
Mhm.
And yeah, acid reflux. So these are common with women who have PCOS. With the bloating and then the constipation, like if your bowels are not regular, it's kind of giving you, like, it's telling you that you're one of the pathways where you can get rid of the excessive circulating hormones or androgens,
Right.
that pathway is not working. So then it makes sense if you're seeing these uptick in certain hormones like your estrogen or your androgens, right? So
Mhm.
again, so it looks like, okay, gut needs to be looked at. So that's one of the phases. I said, like my program has the blood sugar piece, which is phase one, the
Mhm.
nervous system, phase two, and then the phase three is the gut. Because we cannot bring anything into balance without like looking at the gut for sure.
Yeah.
Yeah.
Cool.
So yeah, those are very, very common.
Yeah. Well, with IBS, like the main, or we know now, like the main
Mm,
driver of symptoms is gut dysbiosis. So something is off track, like in the
hmm.
intestinal microbiome, mainly the large bowel, but sometimes it can be in the small bowel. And there's some imbalance there where there's more pathogenic bacteria and not enough of the good. And we know
The good stuff.
more
Hmm.
pathogenic, they create sort of endotoxins, the common ones being like the lipopolysaccharides, which then can create like inflammation on the lining of the gut. And then also sort of causes like a heightened response with the immune system. So we tend to see like more mast cells, which are like our immune
Mm.
system cells and those with IBS. And then that leads to actually the symptoms and the oversensitivity to.
Interesting. And what about histamines? Do you see that too?
So the idea is that like the increase of mast cells in
Hmm.
the like intestinal tract is where maybe like the response to high FODMAP foods or just like a hypersensitivity response
Hmm.
to even just like normal fermentation of fiber or
Right.
portions can result in that just like more sensitive nerves of the gut in IBS. So there's
Mm.
actually like a strong like immune system piece.
There's a piece to it. Mm.
But that said, like even we know now like the imbalance or the dysbiotic state in the microbiome can also contribute to like difficulty regulating blood sugars, and even diabetes is linked with dysbiosis. So I can see how like then PCOS, which maybe you said the root is at insulin resistance,
Yeah,
actually be maybe even driven by like dysbiosis
absolutely.
too. Yeah. Would you agree?
Absolutely. Yeah, totally. So usually when you look at the gut of a woman who has PCOS versus someone who doesn't have PCOS, the the person who has PCOS, their gut bacterial population is definitely off. So you see a higher population of the bad, lower population of the good.
Mhm.
So the lactobacillus, those are quite low in women who have PCOS. So all the helpful bacteria are on the lower, they're trending downward.
Right.
So that also makes sense because your cells get more resistant too. So if your gut bacteria is not sort of, if you don't have the best population of like your helpful bacteria, then yes, you get more insulin resistant over time. Inflammation is also coming from there because your immune system is literally all in your gut.
Yeah.
You see mood fluctuations. Again, that's connected to your gut. We talked about the nervous system, which obviously runs all the way down to your gut. So yeah, that's a very common thing for sure.
Yeah. I know I was reading that I think the gut microbiome profile of women
Profile,
with
yeah,
PCOS was seen to be different than
correct.
those without. Yeah.
Yes, I think it's the two that are definitely low is the lacto and then uh, the bifidobacterium.
Mhm.
The both are on the lower end, which we want more of. So yeah.
Yeah. And we see those low in IBS as well.
Oh,
Yeah. And unfortunately, they can further decrease if someone is on a low FODMAP diet for too long.
too long. Yeah, that's
Yeah.
true. So how
Um,
long do people typically stay on low FODMAP with you?
so I would say low FODMAP diet is as a process, like it's a
Yeah.
3-phase process. So the first phase, which is like our elimination phase, where you're just eating low FODMAP servings as per the
Mm-hmm.
Monash or FODMAP friendly
Monash. Yep.
testing. Um, Minimum 2 weeks because you need that
Yeah.
amount of time for an elimination diet, up to about 6 weeks. Sometimes
Mm-hmm.
I have people like do a little bit more if we're working on other things because
Yeah.
we don't do just low FODMAP. There's more going on.
Yeah.
And then I like to start people on the challenge phase where we
Nice.
strategically introduce foods and then personalize. But that said, I have so many clients that come to me that are like, they saw their doctor, handed a low FODMAP
Mm-hmm.
diet list,
List.
and they've been on it
Yeah.
for 10 years. And
Oh
then they come to
damn.
me and we have to get them off
Get
of
your
it
gut.
and do a lot of work
Yeah.
to correct the microbiome because it's just their diet's been so restricted because FODMAPs are prebiotics. They're a lot of really good healthy foods. So being on it too long actually works against us. So but that's a whole
Absolutely.
another
Yes.
conversation.
For sure.
I guess with the connection between like our sex reproductive hormones,
Mm-hmm.
which I believe includes like our estrogen, progesterone, and then the androgens like testosterone and DHES.
Mm-hmm.
How did those like maybe connect with the gut? Like I sort of have like somewhat an understanding of this, but
Yeah.
maybe explain like how like what regulates or if what the connection is between how the gut regulates those.
Yeah, for sure. So as we were talking about earlier in terms of, we've got like these good bacterial population and then the not so good population, right? So out of one of these good ones, we've got something called estrobolome. And that's a set of this bacteria that helps your body sort of metabolize all the excessive circulating estrogen in your system and then actually get it out of your system. So excrete it. But now, if you have lower amounts of that, that means you're recirculating a lot more of that estrogen in your body, which means severe PMS symptoms, really tender breasts before period, irregular period and cycles too. So you see or really heavy periods. That's another one, right? With it. So you see these like signs when your gut is not supportive of the like to get rid of the excessive estrogen in your system. Now, with the androgens, so we were talking about how like um, the bacteria help, the healthy bacteria help your cells being more sensitive, right? So now, if your cells are starting to get more insulin resistant due to a poor bacterial population, so then that's now telling your ovaries to continue to make all that excessive androgens. So that's the pathway in terms of like how the gut will also affect your androgen metabolism.
Interesting.
Yeah. And then there's another thing too. I mean, it's kind of connected because we've got these binding hormones, like the sex hormone binding globulin that sort of attaches testosterone and the other androgens, right? Which is kind of made in your liver. But one of the ways, like a lot of times, we see lower levels of that with women in PCOS, and in order to actually increase it, one of the recommendation is to actually increase fiber intake, just because the more fiber you eat, it also improves your gut lining. It's producing that short chain fatty acid. So
Yeah.
It's sort of like, again, helping your liver also improve its function, which again, when there's fatty liver, then these these binding hormones start to drop down too. So it's very like interconnected. You can't just be like, yeah, this is the pathway. This is how gut does it. It's like the gut is
Mhm.
connected to something else, and then something else is doing something else, and then it will get you to the results that you're looking for.
Yeah. I think it goes back to like the health literacy piece, but I think that sometimes it's like a common, I guess, maybe thing amongst people who don't work in the healthcare space or you're not
Hmm.
talking about it all the time, but sometimes we don't realize like how complex our body is and that
Yeah,
there's so many
everything.
different things and it's trying to regulate things and if something's out of balance, it's going to show up in other places and it's good to remember that too even with conditions like PCOS and IBS. It's generally not just like one thing that you're doing. It
Hmm.
has to be a combination and probably a combination that's right for you that's getting to really the root of your specific drivers and the heart.
Absolutely.
It could take time
Absolutely.
to figure that out, but once you do it, as you're saying, like it can be well managed.
Yeah, very responsive. Your body is responsive. I always tell my clients, think of that yes, your body's not broken, it's responsive. It's an
Yeah,
affirmation I tell you to repeat over and over while you're on your healing journey.
yeah, for sure. Yeah, that's a good point about the fiber. I know if someone has like low estrogen, or maybe told to like drop fiber because fiber can too much fiber can pull out like extra estrogen. But to that point, I guess if someone maybe is not getting enough fiber or if they're constipated, like they're getting backed up, then maybe they're getting a buildup of these types
Mhm.
of hormones because it's not properly getting eliminated or I guess balanced. Would you say
Absolutely.
is it just like estrogen in that case, or do testosterone, like the androgen hormones, build up with
The
constipation or bowel issues?
well, um, so the bowel is an area for excretion for even like excessive androgens, but more like the most research we have is on estrogen rather than the androgens. There isn't so much like clear cut information on that, but I can kind of see how if you're not sort of passing your stools and for example, like your fiber is not binding to excessive androgens or estrogen, things like that, that you can technically sort of start to see the buildup of these things.
Yeah. Okay. Interesting. What would you say are maybe like key nutrition strategies? I know it take be like a whole episode, probably just
Yeah, yeah,
on
totally.
their own. But what would you maybe lay out as like top 4 to 5? We'll talk about nutrition first, and then
Okay.
the lifestyle
Okay.
separately
Okay.
for
So
PCOS specifically.
fair. So if okay, so just to simplify it, I always be like, okay, blood sugars first, right?
Yeah.
So we want to make sure you're eating in a way like each meal is an opportunity for you to kind of keep your sugar stable. So take a look at that and see, do a mental checklist. I'm like, okay, do I have enough protein in my meal? Am I eating the right amount of carbs? Which again, they're even the most healthiest carbs in large amounts than what your body needs is still going to cause that blood sugar spikes. It doesn't matter if it's quinoa or something super fiber rich. If you're going over the carb dose that your body can tolerate at that time while you're sort of like trying to reverse your symptoms, it may not be effective. So a plate model is generally a really good place to start, to be honest, right? Which is half your plate being veggies, quarter of it being your protein, another quarter being like a complex carb, and then spacing your meals. That's another one great tool for keeping your blood sugar stable is rather than having very abrupt meal timings, not eating like for 6 hours at a time and things like that, that can also dysregulate your blood sugar. So I always tell my clients to just space your meals out every like 3 to 4 hours. That's a really good place to start. Again, it's very easy. These are like really easy tools to kind of start with.
Hmm.
Um, Even eating breakfast. So I know we have this thing like, oh, breakfast is the best meal, is the most important meal. I mean, it is, especially because now the research is showing that when you eat large amount of calories at breakfast, you have lower androgen levels. So having a decent breakfast within that first hour is a great way to sort of set yourself up because you're fasting overnight. So you're already in a fasted state, which is good. Like a 12-hour fast for women is fantastic. You're working with the circadian rhythm. Lovely. But then if you're going to keep pushing it like intermittent fasting and things like that, then that could be an issue. How many do we have right now? So we talked about
Shoot.
plate, we talked about meal spacing,
Breakfast, I
eating
guess.
a breakfast,
Yeah.
Three. Okay. You want a fourth one. Okay. Let's think about, and then the fourth one I would say is fiber.
Right.
So I know people focus a lot on protein and like, yeah, protein is everything. And I would beg to differ that I would say fiber is the star. You want to really make sure you're getting enough fiber in. Women who actually do have higher androgens, I do tell them to aim for 30. So usually for women, we need to eat like up to 25, but I go over if you're having higher androgens, because I do see that. It's just that we don't have that solid research papers showing that, yeah, it's really helpful, but I'm like, I see it. So I'm like, okay, let's aim for the higher amount. And so the fiber. Yeah.
Yeah, I can see like overlap, I guess, with those strategies for IBS too. A lot of times it is like eating earlier in the day, getting a good dose of protein at breakfast.
Mm-hmm.
Also, if someone is maybe under eating or skipping meals, that can actually contribute to anxiety because of blood sugar drops. And then because of the gut brain connection, I find it can actually worsen like IBS or gut symptoms.
Mm-hmm.
Yeah, for that case, like protein is key, and especially for women too, like getting more in the morning. To the fiber piece, definitely, yeah, fiber is so undereaten. I know with my
It's so under eaten,
yeah,
yes.
yeah, just in like regular population, but specifically with like IBS or I have IBD,
Yeah.
inflammatory bowel disease, like there's a bit of a fear around fiber because of the FODMAPs. But if someone did have like PCOS and IBS, like there are ways that you can get the right types of fiber in the balance so that you can still shoot for 30, or I have clients do 40, 50 without like worsening.
Amazing.
So I think in
Amazing.
that case, like just goes back to working with a dietitian can be helpful. If you find yourself
Totally.
with these things and like you're trying to reach a goal that you think that will be helpful for you, but maybe how you can actually implement it into your life, I think that's
Absolutely. Exactly. If someone's not eating like fiber, no one starts at like 30, right? Like I have clients when I'm doing an assessment, they're like, yeah, whenever I'm eating like lentils or beans and chickpeas, I'm very gassy, very this, very that, right? And I'm like, okay, when you look at the diet, your diet is so low in fiber. So when we're also eating these foods in larger quantities all at once, your body has no way to sort of like digest it as efficiently as it can. So it takes time to build that up too, right? But again, the more you sort of introduce it slowly and strategically into your diet, you can sort of see benefits of these foods too that typically you're like, no, it gives me bloating, but it may not be a bloating issue. It actually is just improving your digestion a little bit more. Sometimes it's that.
Yeah, that's a good point. Yeah, I do talk about sometimes like retraining the microbes, because if you
Yes.
eating along like a low fiber diet for a period of time, your microbes are used to that. So we kind of have to retrain them to, or build more of the types that actually break down beans and fiber.
Totally.
Yeah, getting into the lifestyle strategies, and yeah, I did want to ask if maybe like sort of the products that we use are sort of our like environmental
I love that.
toxins will relate to this, but maybe you can highlight like top 4 lifestyle
Yes,
strategies.
I love that question. Yes, I, honestly, the environment. We obviously, that's another piece. I forgot to mention this, but one thing I explain to my clients, I'm like, look, we can't be in a bubble. We can't protect ourselves from like these microplastics and like people wearing perfume on the subway and you being exposed to all that. But guess what you can do? Your gut bacteria actually helps to get rid of these microplastics out of your system. So that's another opportunity for you to work on the gut in order to actually protect yourself from the environmental stuff that you're getting exposed to. So I forgot to mention that. But yeah, cookwares is really important. So because that's something you're using often. So really look at like using stainless steel, cast iron, trying to avoid like the Teflon, those nonstick pans. Those are really important. As a woman, of course, products. So just opting for like fragrance free. So these are like really small switches. It's not like, oh my God, I can't wear makeup anymore with my favorite brand and things like that. Like just try to reduce the load as much as possible. I know, what was that, Bath and Body Works or something was so popular. I don't know. I think it's still popular. I have no idea, but like that is like, yeah, place for disaster, because everything from like their candles to their sprays and everything, they're like packed. So if you're constantly putting it on your skin, right? Even perfumes, women love to spray it right on your wrist or right behind your ears and stuff just to smell good. It's going right into your bloodstream. So just being a little bit mindful of that. Like, oh my God, I used to love perfumes. Like I came from the Middle East, and Middle East is like known for just perfume overload. And from there to like, I do have a perfume, but I only wear it on my clothes if I'm going out, and I'm just like significantly reduced it. Changed my deodorant. So those are really good little changes you can make. And then, of course, supporting your body in terms of like stress, right? So your nightly routine, your morning routine, even if you have just 5 minutes, trying to like set that up for yourself and make sure you're dedicated to like unwinding before bed, because again, we're so overstimulated. I feel that also plays a huge role in the quality of your sleep. So those are some like habits that can really help in terms of the lifestyle.
Yeah, that makes sense. Yeah, to the body products one, like I forget about that because it's something I actually changed like a long time ago. I think I was like maybe, yeah, 16, 17. But
Oh,
I was
wow.
like
That's
a whole
amazing.
detox of
Oh
like
my God. That's
everything.
amazing.
So to this day, like I don't wear perfume. If I buy any
Amazing.
product, body products or makeup, I get them from, we have like Big Carrot here, Healthy Planet.
Yeah.
Check that they're like environmental working group certified and
Oh, so
try to
cool.
minimize it. I find for me, like I just feel it. Like I notice now if someone's maybe wearing like those sort of artificial scents, like it.
You get a headache? Because I
Yeah.
do. Yeah.
Yeah. And it just feels so much like lighter. I've heard like some people say that maybe, there may be problems with the product and the marketing. It's not as clean as it says, but for me, like I do notice a difference. And I do believe that I think what we put on our body and our skin gets absorbed. And I think just trying to be like as mindful of that too. Like if we're going to
Totally.
care about our diet, we want to like care about the body products as well.
Absolutely.
So, yeah. You didn't say exercise though. So
Yeah. Good question. Good. Yeah. Honestly, even with the work I do with my clients, the first area we work on when it comes to movement is just gentle movement. So walking is my first choice when it comes to sort of hormone health, because your cells start to get more sensitive to your insulin, so that's a great place. People are coming to me, they're already fatigued. Like imagine then telling them that, hey, I think you should no, that's not a great way to start. So once they start with the walks and just getting their body moving and they start to feel better, their fatigue starts to reverse in week 2 itself. So then they're now more invested in like doing other little things, right? And then in the long run, of course, just strength training is one of the best ways you can also regulate androgens, because it's really good to sort of like maintain that balance. When you have more muscle mass, your metabolism's better. It's also like a sponge for sugar. So when your blood sugars are rising, your muscles are able to soak that up. So that would be like the next phase when it comes to when you're building like a nice exercise plan. So I always look at first, if you're not doing anything, start with walking. Now, if you already are someone who's hitting like 7K steps daily and 7 to 8, then maybe your next step could be starting to add in 1 or 2 days of strength training and then sort of like move your way up.
yeah. Always want to build the base.
Yeah.
Not going too heavy. I know with sort of maybe just general population, and then also with IBS, like we're seeing now that for women too, like having some high intensity exercise, like within the right balance, not over.
Right balance. Yes.
Having rest days, like
Correct.
should be balanced training. And myself as like endurance athlete, like, do hard every day. But for the PCOS population specifically, do you think like high intensity interval training is beneficial, or do you feel like more strength training, moderate intensity?
Moderate. I mean, to be honest, there is room for it, but that's like if someone's coming to me and they have really poor stress management, and the evidence is like, okay, this person is like cortisol driven. They're waking up randomly at 3 o'clock in the morning. They're unable to sleep, and it's like the classic cortisol sign, right? Where you're not hungry in the morning. Those are the ones I would tell them to sort of like take a step back from the high intensity for short duration, which again is not something you do for long term. It's for short duration till you start to like learn how to sort of stabilize your lifestyle a little bit with your nutrition, supporting your cells, supporting your nervous system. So we do a lot of nervous system work, which is all the somatic work. And then when they start to feel better, then we start to introduce it. But usually at no more than like 15 minutes, to be honest, like 15 to 20. And I would typically keep like a couple days of rest in between. So you might want to do a more slow weighted exercise rather than doing 2 back-to-back hit training.
Yeah, for sure. Yeah.
Yeah.
Yeah, I mean, with high intensity interval training, like it does, we know it like increases cortisol, but it can actually
But
be a
brings it down.
beneficial response.
Yes.
So it's more about how your body can bring it down
Bring
between
it
and again, for
exactly.
someone's not like, yeah, not managing stress well, not sleeping enough. They've got a lot of like external stressors. Then in that
Correct.
would be good. But I think long
Correct.
term, they have shown that it can help with insulin
Exactly. Yeah.
resistance. So
Insulin.
it's not
Yeah,
something to get out.
absolutely.
Yeah, yeah,
Great cardiovascular benefits too, right? With again, with like the blood sugars, the fatty liver that's showing up. Heart health is a big issue with women who have PCOS as well. So
right.
it can be a really great way to even improve your cardiovascular fitness for sure.
Yeah. And it's efficient too. Like even
Yeah.
the true definition of
Yeah.
high intensity training is it shouldn't be like 30, 45 minutes because technically if you're working really hard on those intervals, you can't sustain that
Yes.
for too long. So
Yes.
15 minutes, like it can be, it's hard, but it can be a very efficient workout. So
Totally.
well, again, a whole nother like topic, but I wanted to bring that one up because I feel like it's a common, maybe, I don't know if it's a myth, but maybe a misunderstanding that like if you have PCOS, you can never do a high intensity.
Oh no, no, not at all. Yeah, no, no, no. Yeah, but people do
Yeah.
believe that. I've heard that. We're like, oh, you can never do this or you can never do that.
Yeah.
It's all about like retraining your body a little bit, right? So as I said, like you want to look at your lifestyle and be like, okay, if I'm not managing my stress, I can't stress my body, and you're not eating enough calories, and you're
Yeah.
skipping meals, and that. So if your stress bucket is like overflowing, then let's
Mhm.
not start with high intensity workouts, right?
Yeah.
Let's start with something gentle. And then as you start to sort of like sort that bucket out, then yeah, bring in I like a variety. So a little bit of strength training, make sure you have your NEAT, like your walks going,
Mhm.
a few days of like high intensity training. It's not that you can never do it. You have to train your body for it. Like I had to do that for a while too, because I used to sprint a lot, then I stopped because I was starting to see some like more androgens. Again, my periods are completely irregular, so I can't like be
Mhm.
diagnosed because no cysts on ovaries. It's just more elevation of like androgens. And so I had to take a step back because the nervous system piece is a big one for me. And then as that started to get better, then I was able to go back to like sprint training and things like that. And no issues, no side effects, not like I'm exhausted or anything like that. It was great. So it's just paying attention to what your body's like telling you, I think is really important, and just getting like just understanding that it's not maybe for now, but it doesn't mean you can't do it forever.
Yeah, for sure. I think even building the base with diet, because you mentioned stress, like, yes, stress can be sort of like personal, emotional conflict,
Mm-hmm.
under eating, like just not
Yeah.
getting enough of the right calories or enough
Is it
calories during the
stress?
day.
Yeah.
And then also, maybe fasting or not feeling up for those workouts, that will then increase the stressful impacts that it has on your body. So I think even working
100%.
nailing down your diet and just get like fueling properly to set yourself up for success, and then maybe
Mm-hmm.
layering on the more intense training once you're feeling better so that your body's
Totally.
actually able to like get the beneficial effects of
Totally.
to be
Yeah.
staged approach.
Totally. There's just simple things, right? Like jump rope. There's like short sprints if you want to do that on your treadmill. There's just so many little things you can do, and it doesn't have to be like going from 0 to 100. You can just build up your stamina, build it up, and then go from there.
Yeah, for sure. I guess maybe if you were to like nail it down to 2 takeaways for our listeners today on how they can better support, let's link it to like support their gut health for better hormonal health. Maybe what would you say are like two like key things that maybe they could start with?
Okay. One is, I think, more of a mindset thing, to be honest. So one thing I would suggest is just giving yourself time and being patient as you're starting to like put things into practice, because it takes time like to change your gut environment. It's a slow process, but you will see the benefits of it. So just being patient and not giving up right off the bat that, okay, I'm not seeing any changes. So patience for sure. And then what else would I say would be a takeaway for PCOS and gut? I think what we were talking about earlier is if you're looking for sort of like support, or you're trying to implement things, is making sure you're actually getting the information from like credible information from someone who's actually educated in the field and has a degree, versus someone, hey, I've just been on this journey and I can show you what I've done. So trying to be mindful of that. I think those are probably the two takeaways I would suggest.
Yeah, I like those. Okay. I thought you were going to say fiber, but I think those are better.
I was thinking of fiber. I'm like, should I say fiber or should I say this? I'm like, I don't know. I felt like I think people need to work more on their mindset when it comes to these complex like health situations because it can really like wear us down, right? So just taking time and then making sure like take your time, be patient, and then two, make sure the plan that you're starting off on is actually good for you, right? So not trying like, okay, I'm gonna try to reverse my insulin resistance. Okay, let's cut out carbs because they're saying that carbs raises blood sugars. No, let's take a step back and see how is this going to affect you in the long term. So it's just those things I feel like are more important than anything else. Because once you have the plan and it's a solid plan that's going to work for you, that's your lifestyle. You're going to continue to chip at it, right? It's not like an end date that you have in mind that, oh, I'm going to balance my hormones and improve my gut health until this date. It's a long-term thing. So you just got to make sure that the plan is really supportive for your lifestyle, your cultural eating pattern, the way you live, right? Just looking at all of those things.
Right. Yeah, makes sense. And yeah,
Awesome.
I like the mindset definitely to work on that for myself, like personally, and try to apply those things, but with my clients too. There was a good quote from I don't know if you've read it, but Kelly McGonigal, she's like a researcher at Stanford, but
Okay.
the upside of stress. And I think her quote was like, mindset puts in motion like a series of sort of processes and actions that perpetuate like progress. So her idea is like,
momentum.
it's not that mindset is like a miracle worker. Like if you think it's going to happen, it's going to happen, but it's more that just like thinking positive and like sort of like even just internally vocalizing that you're working on things to get better, your condition is going to get better. That will just help you to feel more motivated to do the things that you'll actually get better. So it just sort of puts you on sort of a positive trajectory.
I love that.
Yeah, it's a good book too. I'm going to link to it below.
Is it? Okay, link. Okay, send me the link. I want to look into it. That sounds nice. Yeah.
It's more around like the idea is that the book is called Upside of Stress. So the idea is that like stress can be good for us. It's more just how maybe we respond to it or how we use it in our life. So like, yeah, sometimes stress has negative effects, but like how we can actually use it as like a positive force. So I think you might find it helpful just from like
for sure.
All that. So yeah, just to wrap things up, it's been a very detailed conversation. We went a bit
I'm glad
said that we would, but how can listeners get in touch with you and find more evidence-based and credible content on PCOS?
Yeah, you can find me on Instagram. So my handle is pcos.weightloss.dietitian. I'm sure you'll add it in to your list. And then you can also find me on my website. So it's just www.pcosweightlossdietitian.com. And yeah, just send me a DM or send me an email and we can get connected.
Cool. Yeah, I'll link your Instagram and website below, and I'll link those resources we mentioned.
Oh, that would be good. Yes.
And then if people want to work with you, they can apply.
Yeah, they can just reach out through the website. There's an application. They can just fill that in, and then we'll set up like a 30-minute complimentary conversation just to get to know them, just to make sure we're a good fit, and then sort of go from there.
Yeah, awesome. Okay, well, thanks so much.
Well, thanks for having me. This was lovely.
Yeah, for sure. If anyone has any questions, if they're listening, or any comments, feedback, feel free to leave it below. And yeah, thanks so much.